Hello, Jay. Sorry, we were running a little bit late. We had a patient that was running a little bit late explaining his BRC interpretation. He had most of his hormonal axis was out of balance. He had a
Yep.
lower than normal, lower than optimal estrogen, and then a lower than optimal total, lower than optimal free, and of course, surprisingly, an elevated DHT. So we
Yep.
explained how the capsule could be customized based on his interpretation so that he would get the benefits from the optimized internal biochemistry, and thus all of the cells would respond appropriately, and the hair would of course grow back, and the muscles would develop, and his skin would improve, and his anxiety levels would improve.
Yeah, it's pretty amazing when that all starts happening together. I remember when we revamped my formula, and about 8 weeks in, it was like bam, everything started firing together. Now, whether it was part of the prescription or diet or I'm consuming more protein or whatever it is, but I remember succinctly at that day, it was like, wow, I require less sleep, I have more energy, I have more brain function, and this is just my life is significantly better. So I know that feeling, and it's checking those numbers that then dialing in what needs to be dialed in, which leads us into our segment today. Welcome back, Dr. Ray, the chief medical scientist and founder of the Stop and Regrow program. Welcome back to Ingredients for a Better Life. I'm Chef Jay, DNA Chef Jay. It's good to see you, my friend. And I see life's been treating you well. You look healthy, vibrant, and happy, which is important.
When
So,
you've got the optimized internal biochemistry, everything should respond appropriately. So the hair cells should respond, the skin cells should respond, and the muscle cells should respond. So
yeah,
it's just it's an outcome that you would come to expect as part of the optimal health membership.
I just couldn't believe how fast and how thick the hairs were growing in with my topicals on the 1 and 3 areas in the temples. I was like, wow, these hairs are growing back fast and they're growing back thick. Like they're not just as little, these are robust hairs growing back. A lot of that's the HDL diet and stuff. So we're gonna kind of segue into today's segment because there's a lot to it. So much to talk about on this topic. So let's just get started. Testosterone. So I'll leave it to you. We'll get it going. Just, what is testosterone? I know from getting my labs done that it was usually one testosterone level, but you test for three testosterone. So like, what's that all about? What's the difference? And if you can kind of explain the difference between the three.
Well, that's a very good question, Jay. And it's on a molecular basis. Where does testosterone derive itself from? Where does it come from? And since you're part of the Optimal Health membership, you understand that HDL cholesterol, that molecule is the molecule that comprises the total testosterone molecular derivatives. And once inside that, we call them buckets, but there's no buckets, but it's a good way for the mind to conceptualize of things. So the big bucket would be the total testosterone bucket. And then from that bucket, you can transform that testosterone molecule into other closely shaped testosterone molecule derivatives. And as soon as you make one turn here and you take off one of these bonds and you close this loop, then it changes the function. And that's where it starts to get fun. What is precision medicine? What is precision science? What is a molecule, and what does it matter? Well, it matters. It's the atoms, right? We live on an atomic scale. At the level of the atoms, and smaller than that would be the electrons. So we're
So,
living at a scale that is very small and finite, and with small changes, you change the outcome. And those outcomes would be the functions of the molecules, and the change of the functions would change the cellular response.
right.
So precision medicine is practicing epigenetics, where you change the environment precisely into an optimal range, and you have a conversation with your internal DNA inside each cell inside your body, so that all of the cells respond optimally, not just the hair cells, as you found out.
Right. Now, so let's talk a little bit about testosterone and free testosterone and how it shifts.
Uh-huh. So the total testosterone, as we discussed, would be the big bucket, and then the enzymes that are made from the recipes, from the ingredients found inside your blood, based partially on your nutritional choices, and moreover on the recipes that come from genetics, which were inherited from mom and dad, that will dispose 87% of us to having the hair loss imbalance, also imbalances the lean muscle development.
So you're speaking
So,
of the enzymes that we inherit potentially, and it could affect our testosterone if it's not adjusted. Is that fair to say?
on a molecular level, everything matters, and the nutrition, the genetics. So that total testosterone, the big bucket, via the enzymes, can change into the free testosterone. What is free testosterone? It's unbound. But using X-rays, it would be as if we were looking at an office using a flashlight, and you could see the windows and the doors and the door handle. Prior to using precision medicine X-rays, we couldn't see inside the house. So
Yeah,
now with X-rays, we see that the total testosterone, for example, would have been the only thing we could have derived 20 years ago, 50 years ago. Well, now we you don't know the total testosterone can change into other molecular derivatives, the free testosterone, which would be correlative to the good testosterone, to make it simpler. So the good one, the same as the HDL, would be the good cholesterol,
sure,
and the LDL would be the bad
sure,
cholesterol, is the way we look at it. So the dihydrotestosterone would be the what we would call it, the bad testosterone. But it's not necessarily, as you know, it's not necessarily the absolute numbers, it's the ratio of the numbers inside your individual biochemistry. So that's why each patient needs to go through a thorough BRC interpretation and evaluation and assessment, so that we can then customize their oral formula that would repair all of the imbalances, so that they would have an optimal internal biochemistry based on all of those molecular derivatives. And the other thing that the science proved and we learned, that we now share with the public, is that the testosterone molecule that comes from the HDL molecule can turn into an estrogen molecule.
right.
And sometimes that's a good outcome because we want it to, and sometimes it goes in that direction a little bit more than it should. And that's something that we can regulate, and we can then transform the estrogen molecule back into the male molecule, the total testosterone, and then we work on the ratio. So it's about understanding the
Yep.
inside of the
And
body.
I know that can be dangerous territory for somebody that could be taking one of those, pre-packaged finasteride programs without getting blood work done. And if you don't know, what your hormone levels are doing, or if your estrogen is elevated and you're, taking the wrong dose of the wrong medication or finasteride or something, you can actually cause more harm to your hormonal system. And that's pretty that's not okay for a young guy or any guy for your hormones to be unbalanced, so like to take something or without testing, without being tested by a doctor like yourself, without doing the blood work, I believe is like a borderline negligence almost by their part.
Well, the good thing is today we have the ability to evaluate the blood work, so we can have patients that send in or just want us to read their blood work and find out what their levels are at based on the programs that they're on. So if they're already on a program, we can evaluate their blood work for them. So just contact the office. So no one should be without the knowledge today. You're right.
That's good. So just to kind of make it clear for our viewers, we all know, or they should know, HDL fats are those good fats that actually can increase our testosterone if that's correct. Like it used to be back in the day, you'd go into your internist, he'd take your blood, he'd say, "All right, Jay, your LDL is kind of high, so you want to stop eating this, stop eating that. You'd stay away from the fried foods." Whereas now you find more people that have lower LDLs, which are the testosterone building healthy fats comes from, avocados, nuts, things like that. And people aren't eating enough of them. So it's kind of like if you eat more of the HDL, it'll bring that LDL down naturally. And I'm not, now correct me if I'm wrong, it will increase your testosterone. Is that correct? If you increase HDL, testosterone can go up.
That's correct, Jay. We've seen that across 6 continents worth of data where we have committed some of our patients to increased HDL diets, and we've correlated the increase of their HDL over the course of time to an increase of their overall total testosterone, which also increased their free testosterone. It only makes logical sense. We now have the scientific proof that supports the logic in that direction.
So one more thing that just came across a comment that I'd like to for you to answer is it the same for increasing testosterone using creams or other boosting supplements? Or is that just rubbish, or is it all in from inside out?
Very good question from the was it Instagram or the
That
followers or
that was a
the
Twitter actually.
Twitter? Okay, so the increase in the total testosterone. The question was, what was it, Jay?
Are the supplements, the testosterone creams and or the other
Okay,
boosting supplements, are they
okay.
valid? And
So you have to be very careful, right? If you don't know a lot about the molecules that you're ingesting or that you're rubbing on your skin and how those molecules will react to the enzymes inside an active skin cell, which means it's gone through thorough testing, you don't know what would happen. I've seen lots of interesting findings in the blood work based on some of the types of boosters and supplements that people are taking. But it's not as if you're precisely choosing which molecules to increase and which molecules to decrease with a precise science. It would be as if you're throwing something on the wall and seeing what sticks, and you check the blood work to find out that, hey, something went up, but it could have been the wrong something. So
right.
the testosterone creams, especially the prescriptions that a lot of the manufactured companies make, and what most of the physicians are prescribing, actually go through the skin cells enzymes, and they will boost the dihydrotestosterone to triple what they should normally be, and the estradiol numbers as well. So no one should be using the creams to get the testosterone molecules into their body. All we
Yeah,
need to do is somehow figure out a way to get the molecules safely inside, and that's through a small injection. You what's called bypass the skin's enzymes, and you bypass the deleterious effects of the increase of the dihydro and the estradiol molecules, and you get precisely the increase of the free testosterone molecule that you're going after, and you realize you can use much less of the active molecules to get the desired outcomes. Does that make
that
logical sense?
it does. And you hit the nail on the head one time. You said, look, there's two types of people in the world. There's people that follow technology and they follow science and they follow they actively pursue things like their health and getting these absolute numbers from these tests you've developed, which are total straight numbers. They're nothing else. It's straight numbers and ranges. Then there's other people. I call it New Year's Day syndrome or New Year's syndrome, is where they join the gym, they get the trainer, they wind up never going to the gym, but they want to just talk and they want to speculate about it. They want to consume their time. So the thing is, it's just to go get the blood test. Otherwise, you're speculating about your health. And, as we get older, whether you're 20, 30, 40, 50, you become that many years just out of adjustment. Like, no different than a classic car or anything. You need to fine tune it, find out what it is, and then move forward more vibrant than you were before. So, there's two types of people, and two types of people will do two different things. Some people just want to, ask all these silly questions where it's like, just go get the blood test.
Let the blood work do the guiding, right? It guides the conversation. Otherwise, it's what ifs. Well, hey, what if? Well, what if my car had a carburetor problem? What if it had a
Well,
radiator problem? So today you can look under the hood with an X-ray, which
yeah,
is a pretty high-powered flashlight. And to someone who's a specialist in molecular medicine like myself, it's as if I'm using a flashlight to look inside a house. So it's not going to be speculative at all. It'll be a number, a range system that you'll understand and you can follow along with us, and you'll learn a lot along the way.
I know a lot of people like myself. I'm a boat owner. I have a boat engine. I do boat maintenance, or I schedule it with a mechanic. People know more about their cars and toys than they do about their internal system. Like if you walked around and asked someone, "Hey, like, what's your LDL cholesterol level, or what's your A1C, or what's your," they wouldn't tell you. They couldn't tell you, because they don't test for it. Some of it's fear, some of it's lack of knowledge, but everyone walking around should know what these numbers are, whether it's for hair loss or anything, just because there's always room for improvement with a diet. Because sugar, it's hard, man. It's hard. I struggle with it myself.
Well, you're right. If you ran into an OHA member that's a part of our network, you ask one of those 9 biomarkers, you'd get the answer for sure. And that's going to be the goal: is stop and regrow in precision medicine is less about repairing hair loss, which affects 90% of society. It's more about getting them to understand how the body works and understanding those 9 biomarkers, which will explain 99.9% of all the thoughts that come from their physical body's responses to the environment that they surround themselves
It is nice to have that nice hair, though, I have to say.
in.
Um, I'm very happy with it, and thank you for all your work, helping with that and how everything else comes together. And doctor, just thank you for being the good doctor out there, fighting the good fight. Working with people to help them. Not only, hair loss isn't just hair loss. It's self-esteem, it's self-confidence, it's preventing diseases, bringing down blood sugar levels, preventing heart disease. Like these are things that a lot of people, unfortunately, the United States, if you look around, it's very unfortunate. I don't know the percentage, but most are morbidly obese, and have blood sugars that they're walking time bombs. It's very sad to witness. And we're kind of a smaller percentage of people that are getting larger, but it's still, we are not the average by far. And Europe is the same. It's this modern convenience: do it now, do it yesterday, get it done, work, work, work. But I think, for me at least, it's about reevaluating your priorities, your consumption, your spending, and then you realize things like this program, it's cheaper than going out to lunch, every day. So it just it's a it's something for people to dig into and to say, hey, like, what's important? How important is my health? Is my life? What's my life worth? And if your life's not worth $7 a day, then you're not going to have a very good life.
it would make it tough. So I appreciate you, Jay. So the daily bread is the gift that's given. What you do with it is the gift that you return. So it's all about taking the time that you're given and give something back. And
Yeah, for
optimal
sure.
health is a choice. To your question, I think it was 2018, 84% of Americans are overweight and out of shape. You could call that Europe as well. You could call that Japan. It's an westernized civilization. It's a leisurely type of culture that rarely exists. It usually exists when a civilization is in decline, which is exactly what's happening with the society today.
Yeah. All right, doctor. Well, thanks for checking in. You always are an absolute pleasure to talk to you, and the information. I will make sure to get out there and answer any questions, comments. And until next time, you have a great life, and we'll see you soon, my friend.
You got it. Thank you, Jay.
Thank
Appreciate
you for your
it.
time, doctor. Take care.